Hey everyone, it's Dr. Hodges, and today I kind of wanted to talk to you about high blood pressure. We are celebrating High Blood Pressure Awareness Month, and I wanted to discuss a little bit about how your weight can contribute to your high blood pressure. I want to talk a little bit about how weight loss surgery can positively impact your blood pressure, and then finally, what are some things that you can do to help control or lower your blood pressure, whether you're a candidate for surgery or not, or if you're just someone that just wants to stay nice and healthy. So some good fun facts about high blood pressure. You know, what we know is it affects millions and millions of Americans, and over 60% of Americans right now are considered obese. Obesity has very, very strong ties to two different health problems. And in fact, I believe the studies show that obesity as a whole affects 40 different diseases. And this includes everything from high blood pressure to diabetes to actually to a wide variety of cancers as well. You know, I think one of the things that goes hand in hand as soon as somebody starts to talk about high blood pressure is your doctor will first look at your weight. And what the studies show now is that for every kilogram of body weight that you lose, and for those of you that don't like the metric system, i.e. me, that would be 2.2 pounds. So, but for every kilogram of body weight that you lose, you're going to actually decrease your systolic blood pressure, that's the number on top, by 1 milligram of mercury. So what that means is for every 5 pounds that you lose, you will actually decrease your systolic blood pressure. Oh, pardon me. For every 10 pounds that you lose, you will decrease your systolic blood pressure by 5 points. So if you think about it, then if you're able to lose 20 pounds, you're going to decrease it by 20 points. And so I think that this leads me to the really strong benefits of bariatric surgery. You know, can someone lose weight on their own? On their own, as people will say. Yes, you absolutely can. However, bariatric surgery has just been shown to, number one, provide much more weight loss, number one, but then number two, give you much more long-term weight loss. Ooh, I need to cross the street. Hang on. Ooh, it is busy. Hang on 1 second. OMG. For us to be all shuttered in, everybody's out driving their cars. Okay. So we know that with weight loss surgery, you're going to have much more long-term results with your weight loss. We know that for its effect on diabetes, there's about a 92% remission rate and with diabetes, and you also have a significant remission rate with hypertension as well. So, and for my patient population, generally what I found is, you know, within the first month after surgery, they're able to lose 20 pounds. And usually by month 3, patients are down around 40 to 60 pounds. So you can see just the weight loss alone for your bariatric patients are going to have a profound effect on their systolic blood pressure. Now, what studies have also shown, though, is that it's more than just weight loss that bariatric surgery can have an effect on when it comes to your blood pressure. There's actually several independent factors that are hormonal that have a significant impact on your blood pressure besides the surgery simply causing you to lose weight. We know that it can affect the inflammatory factors in your body. Inflammation plays a huge role in your cardiovascular health, and it's also one of the big factors in cardiovascular disease. Bariatric surgery has been shown to, from a hormonal standpoint, decrease a lot of those inflammatory reactors, and so it helps to decrease the restriction. Oops. Man, it is busy. What is going on? It helps by having a decrease in your inflammation, it will help to decrease the tensile strength that is on your blood vessels. And so that has a positive impact on your kidneys, on your renal system, which also in turn has a positive impact on your blood pressure. So what all that scientific jargon means is whenever you have weight loss surgery, it's much more than just having positive weight loss that gives you a good positive effect on your blood pressure. Now, what if you are someone that has high blood pressure, that's on medication, and you want to control it better, or you're not yet on any medication, or you have a family history for high blood pressure and you want to kind of control it? Are there things that you can do right now, besides having surgery, that can possibly impact your blood pressure? So I think first and foremost, one of the very best things that you can do is control your weight. That goes without saying. But number two is to exercise. Right now, the American Heart Association recommends that you work out moderately, about 150 minutes a week. Or if you want to be a bit more vigorous, I am not a vigorous worker-outer. But if you'd like your boot camps and such, they recommend, if you're doing vigorous activity, a minimum of 75 minutes a week. And that is shown to have a positive impact on your cardiovascular health. The next thing that you can do is you can also watch your sodium intake. Right now, the recommendation is to have less than 2,300 milligrams. I would actually recommend if you could go a little bit lower than that, maybe stick around 1,500 or less. There are a lot of different spices out there that you can use besides salt that will give flavor. So for instance, if you like to use your garlic salt, why don't you just try using garlic powder, or better yet, just use fresh garlic. You can usually grab a couple of cloves for $1, and it's going to have just a much more robust flavor. You can also use Mrs. Dash. Do y'all remember Mrs. Dash? Oh my gosh, I remember growing up, my mom used Mrs. Dash all the time. Tony Chachere's, I think Tony Chachere's has fairly low, or they have a low sodium version, and it's really good. I used to live in New Orleans, and I feel like Tabasco and Tony Chachere's was like a staple, as well as Blue Paint mayonnaise. But Tony Chachere's was just a staple in everybody's cupboard. So get some exercise, watch your sodium intake, watch your fat intake. You know, I know right now there's a big craze for the keto diet, and in that diet you're going to be taking in about 70% fat. If you have a family history for a high cholesterol, or if you yourself have high cholesterol, that is a terrible diet for you to be on. Yes, you might lose some weight, but your liver is going to go kaput. I mean, your liver enzymes, if you get them checked, will just be through the roof, and it's just not worth it. There are other ways that you can use to lose weight. And there are many other diets that you can choose from. Let me see, what else? I think the other thing that also goes without saying is watch your alcohol intake. Although there have been some positive studies on red wine, but that doesn't mean that they want you to drink a bottle every night. I mean, but having a glass of red wine can certainly help. That has been shown to reduce some of the inflammatory effects on your cardiovascular system. So it's kind of an anti-inflammatory control for you. And finally, I would say, if you are a smoker, and I don't care if you smoke, if you dip, if you smoke a cigar every now and then, if you vape, you have your vaping pens, if you're those 420 people out there, it does not matter. If you smoke something, it is bad for you. Your lungs were not made to breathe in smoke. They weren't made to breathe in vapor. So if it is tobacco, if it's vapor, if it's marijuana, I do not care what it is. You need to put it down. Your heart does not like it. Your vasculature does not like it. So you just need to stop. And if you want to have a good positive impact on your blood pressure, that is certainly something that you need to work on. Now, what is something on a positive note that you can do? Now that I've told you not to eat fat, don't eat salt. You have to limit your wine and put down the cigarettes and cigars. You can, however, have a little bit of dark chocolate. And I actually really enjoy the Lily dark chocolate to have the best anti-inflammatory effect and the best cardiovascular effect. You actually need to have a really dark chocolate, so it needs to be greater than 75% of cacao. I found if you go to Whole Foods, there's a brand called Lily, Lily, and it's sweetened with stevia, and I usually will get the 75 or 80%, and it has a little bit of sea salt on there. It is so good. And I think what's nice about it is that not only does it satisfy my sweet tooth, because there still is some bitterness to it. I mean, it's dark chocolate. It's really dark chocolate. It also cuts that sugar craving that I also have. So, and then finally, I would say watch some of your caffeine intake as well. Although there have been actually some conflicting data out there that says certain types of caffeine and green tea can actually help you with your heart health as well. So, but as a whole, try not to do your monster drinks 3 or 4 times a day. Keep that at bay. So I hope that this has been helpful for you guys. I think the take-home message for your high blood pressure is it's something that you certainly can work on controlling. Watching your weight, watching your diet can be big factors. If your physician prescribes you a medication, please take it. There are so many of my patients that will come to me and they're like, I didn't like how it made me feel. Well, guess what? There's 8 million different blood pressure medicines that are out there. Talk about the side effects that you're having with your primary care doctor so that you can find the medication that works for you. If you're a man and it's affecting you, like some of the beta blockers, like metoprolol or atenolol, it can cause some ED. There might be other options for you. A lot of times I will alter some of those medications for my male patients because I don't want you to have a heart attack. But I do want you to make sure that you take your medication if your doctor gives it to you. So work on your weight, work on your diet, take your meds if you're supposed to, and try to live as stress-free as you can. Although in these current times that can be a little tough. But I wish you guys all the very best. I hope that you found this helpful. Give me a thumbs up. Please share this with your family and your friends. And don't forget to subscribe. Bye.